My name is Kimberly Allen, and I'm here to talk to you today about the role of peer recovery and family support in optimizing integrated health outcomes. This is segment 5 of 8 segments, so I hope you'll see them all. This particular one is about employee assistance programs, better known as EAPs, and I interviewed them to talk about peer support within EAPs. This project is part of Texans for Recovery and Resiliency. And TRR is a SAMHSA-supported collaboration between the Family Mental Health Network, which is the Texas Federation of Families for Children's Mental Health, and the Addiction Recovery Community Statewide Network, RecoveryPeople. The purpose of this collaboration is to strengthen peer and family voices in mental health and substance use recovery policy and program development. So when we look at EAPs, we're going to talk about how they could use peer support and family partners, or they do use. In this case, we're going to talk about how they could use peer support and family partners. In case you don't know a lot about EAPs, which isn't unusual, employee assistance programs provide wellness and health promotion services in work sites. So they do training. They have telephone lines where you can call in. You may have a marital issue. You may be suffering from stress. So if you're working in an environment, then there's an EAP, you can call in typically and get help. The EAP services are paid by the employer, the client. So if you work for an EAP, your client is an employer group. And those employer groups typically pay EAP on a per employee per month charge. So here's what that means. If you are the president of an employer group and you care about your employees and you want to provide wellness and health promotion services, you may go out and solicit EAP services. And with EAP services, their role is to keep those employees healthy and working. And this is a big cost saver for employers today. It keeps people more content in their roles. It helps with families. It helps with child care. And how it's paid is the EAP charges the employer per employee per month. So that's all that means. It's a cost that the employer bears, not the employee. The employee benefits by being able to go in and talk to a counselor. So the employees may attend counseling for a specific number of sessions at no charge. So for example, the employer may have purchased a 5-visit model. The EAP model is 5 visits, and I'm the employee and I'm feeling stressed and I need help. So I can schedule 5 sessions with a counselor and it doesn't cost me anything. So EAPs support healthy lifestyles. And as you can see, a lot of EAPs work on phone lines. They support families as well. They support families that support individuals with mental health and or addiction when they're having difficulties. They can do it online. They can do it telephonically, or they can work in person. So employee assistance programs do have clinicians that work on these phone lines when you call in and they answer the phone and they can ascertain what your issue actually is. And then typically, like I said before, you get to go see a counselor. Maybe it's a licensed counselor, a licensed clinical social worker, but normally that's how EAP programs have worked in the past. Now, EAPs, excuse me about that. All right. So the history of EAP, and I interviewed an EAP here in Texas. When you interviewed freestanding EAPs like I did, freestanding just means that the employee assistance program is not part of managed health. Managed healthcare, which is insurance, does have EAPs. They have EAPs that work before you use your insurance. And once again, if I'm struggling with stress and I'm working and I need help and I go in and I visit a counselor 5 times, it's possible that I won't need to use my insurance. I may resolve that issue while utilizing those 5 sessions, and or the EAP does indeed use wellness services. They do provide trainers that come into the workplace. They do have wellness coaches that answer the phone as well. And we'll talk a little bit more about that. This particular executive that works with a freestanding EAP in Texas says the history of EAP was that grassroots movement, was peers in the 40s and 50s. Peers are a huge historical part of EAP. I honestly feel that most people in EAP have forgotten that. It's almost like a lost jewel in EAP, associated with successful intervention and recovery. And what he is referring to is that in the history of EAP, there were persons that were struggling with addiction and substance use disorders, and they did outreach inside their own employer groups, their own areas in which they worked, and they helped each other. So that's what he's talking about. That is the history of EAP. It is a big part of the grassroots movement that started EAP. So he feels like that people in EAP may have forgotten that. A lost jewel. So the same individual, when I asked whether peers were used in his EAP today, he says, our problem-solving process does include online and telephonic wellness coaching, but there is no peer involvement. We case manage them. So what he's saying is that you do not have to have the lived experience of mental illness and recovery from that and resiliency based therein. You do not have to have the experience of having addiction and recovery or having a substance use disorder and recovery. You don't have to have that. You can be a wellness coach that answers the phone, but you don't have to be a peer. Instead, you can be case managed, where they watch the utilization or they watch the usage of what you choose to use or what they encourage you to use, for example, in smoking cessation. They may provide a service like that, and they may be able to coach you with something like that, but it doesn't mean that those coaches actually have that lived experience. So he's clearly defining a difference there. And we do, in the peer movement, have people feel that we are wellness coaches. We do get confused by being wellness coaches, and people don't clearly understand that we actually have the lived experience of recovery. It's something that we carry and something that we pass along. It's very, very important. Here is another quote. We maintain a network of health coaches who manage disease or who are fitness experts, etc. So on private sector clients, we use the health advocate for weekly check-in to help keep themselves accountable. We provide follow-up and aftercare is what we're talking about. So no, we do not have fear and family supporters who are non-professional. So what he means is they do have a network of health coaches who help manage disease, or they may be fitness experts and things along those lines, and they use them on private sector clients. So he's saying that these are working people. The client, the employer group has hired them to be an EAP provider, and they use health advocates. So first he calls them health coaches, then he calls them health advocates. That's not unusual. People do use multiple titles like that. They use those advocates or health coaches to have those employees check in weekly to help keep those employees accountable with themselves. So he's talking about follow-up and aftercare. He's not talking about peer and family supporters who are non-professional. So he was very clear about that. Once I explained what a peer supporter is, what a certified peer supporter is, he said, no, we do not have that. In terms of what peer and family supporters offer, I think that's fully deployed by us. There is no peer involvement. We case manage them. So when we went over this, he re-emphasized that in terms of what peer and family supporters offer, he says that in the EAPs, they do that. So this is not something that peers do. On something like that, I feel like, and he also described it later on as interesting. He was interested in learning more about that. So we're going to talk to him about that. So a lot of this, I think, is just lack of clarity, and people have that between what do health coaches do and what a certified peers and family supporters do. So this is something that we're going to see in the healthcare market today. He was very well intentioned, extremely interesting to talk to, and very interested to talk to me again, so you can know that. This quote comes from International EAP Executive. She did not know what peers are. Peers, what is it? How does it work? How is it paid for? This is something that we'll refer to in another segment. Clearly, she wants to know how it's paid for. That makes sense. I need for you to send me some more information. So once again, the employee assistance programs, this one is on the front end of a managed healthcare organization like we talked about before. They want to learn more about peer support. So it tells me that as peers, we need to go in and offer education and let them know more about peer support. And they're very open to that idea. And both of these organizations asked for me to send them some information, and we'll certainly do that. So if you need more resources and information on this and to view other videos in this series of 8, please contact me, Kimberly Allen, at RecoveryPeople.org. We have a website, RecoveryPeople.org, or RecoveryandResiliency.org. And thank you for listening today.